This young man is 17 years old. His hemiplegia is the result of traumatic brain injury. During walking, his arm has no independent mobility. His shoulder blade is frozen on the side of his ribcage, and the arm helplessly hangs down. His entire left side moves as a single unit. There is no counter-rotation between his pelvis and his shoulder girdle. Bring the arms up like that. When he lies down, we see the causes behind the dysfunction of his arm. His neck bulges, his upper chest is profoundly depressed, causing pronounced protraction of his shoulders, especially on the left. This view shows dramatic difference between two sides. Left side of his chest lacks volume, his left clavicle is depressed and rotated, leaving no space between itself and his neck. Therefore, it's more space here as well. As a result, his shoulder blade slides upwards and sideways. Due to these causes, his shoulder is profoundly rotated inwards, bringing pronounced muscular imbalance to his arm and hand. Distortion of the shoulder causes distortion of his elbow. Distortion of his elbow results in the collapse of his hand, making it completely dysfunctional. As you know, this accumulated error. This view gives us another look at the shift of his shoulder blade sideways and upwards. Two more rounds and turn around. When trying to take quadruped position on his knees and elbows, he avoids the use of his left hand altogether. He doesn't use it neither when putting himself down, nor when he pushes himself up from prone position. Before starting ABR program, he had about 4 years of intensive physical therapy. There were some improvements in the beginning, however, during the last couple of years, there had been little change, forcing his parents to look for more efficient rehabilitation approach. After about 1,300 hours of ABR alone, in nearly 2 years, we see quite dramatic progress in the use of his left arm and hand. When he came to us, he did not use his left side at all. By now, his arm is strong enough to hold his entire weight, and his hand is open in weight bearing. The change of position of his shoulder blade is obvious. From being on his side and upwards, it moved down and onto his back. By now, it is enough to give him the movement up to the horizontal level. Mobility of his legs improved a lot. Try this test with any individual affected by spasticity in the legs, and you'd see how difficult it is to do the movement that this young man just did. That was good. As a result, walking improved a lot. He's obviously still limping, but his leg movement now comes from the pelvis level. His upper body and left arm no longer swing as they did before. The progress of structure and function following ABR program goes from the neck and upper body downwards. The strength and mobility of the upper body is a necessary basis for recovery of the legs. We are confidently looking into the future of this young man when continuously improving mobility at the pelvic girdle would convert into breakthrough improvements in his walk. A lot of positive signs are obvious already. The movement of his left leg is now independent from his upper body swing. The length of his step increased a lot.
Nice. Hands, please. Wonderful. And last time? Okay. Yes, yes. Okay. Don't worry.
His knee, which was unstable and non-functional in his earlier walking, has got much stronger. As a result, he is now capable to jump up using his left leg alone without any support. To fully appreciate this achievement, please ask a spastic child to try to repeat it, and you will see a difference. An example of this fine young man shows that rehabilitation at this age is a meticulous stage-by-stage process. When achievements gradually build up, paving the way to breakthroughs,